In this video, we will talk about Sentinel events. For more videos, visit my Facebook page, Healthcare Quality. Sentinel event is an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof, and any event that might cause embarrassment or risk to the hospital with potential legal implications and/or media inquiries or coverage. Serious injury specifically includes loss of limb or function, and the phrase or the risk thereof includes any process variation for which a recurrence would carry a significant chance of a serious adverse outcome. This pyramid represents different occurrence events levels compared according to their frequency. If a near miss, which represents the white base, was about to lead to a sentinel event, it is considered a sentinel event, and this is another explanation to the risk thereof. Sentinel events are special cause variations falling outside the normal control limits of the process of care. Clinical processes are complex. If a man is treated in the emergency department for headache and dizziness after falling at home and hitting his head, is discharged and within 24 hours is admitted to the hospital with a subdural hematoma and subsequently die, this sequence of events is considered sentinel, requiring immediate investigation and response by root cause analysis. It is important to note that the term sentinel event and medical error are not synonymous. Not all errors result in a sentinel event, nor does a sentinel event occur only as a result of an error. Identifying an incident as a sentinel event is not an indicator of legal liability. Events to which the Sentinel Event Policy applies. These include at a minimum A. Unanticipated death, including but not limited to death that is unrelated to the natural course of the patient illness or underlying condition. Death of a full-term infant and suicide. B. Major permanent loss of function unrelated to the patient's natural course of illness or underlying condition. C. Wrong site, wrong procedure, wrong patient surgery. D. Transmission of a chronic or fatal disease or illness as a result of infusing blood or blood products or transplanting contaminated organs or tissues. E. Infant abduction or infant sent home with the wrong parents. And F. Rape, workplace violence such as assault or homicide of a patient, staff member, practitioner, medical student, trainee, visitor, or vendor while on hospital property. The hospital definition of a sentinel event includes from A through F above and may include other events as required by laws or regulations or viewed by the hospital as appropriate to add to its list of Sentinel events. All events that meet the definition of Sentinel event must be assessed by performing a credible root cause analysis. Accurate details of the event are essential to a credible root cause analysis. Thus, the root cause analysis needs to be performed as soon after the event as possible. The goal of performing the root cause analysis is for the hospital to better understand the origin of the event. The analysis and action plan is completed within 45 days of the event or becoming aware of the event. As such, intensive analysis must be performed in each case, whether the Sentinel event occurs in the organization or is associated with services provided or provided for by the organization. Root cause analysis. The direct causes of injury of an event might be burns, strains, and/or cuts. Their apparent causes could be behavioral, like failure to report or to train, or conditional, like chemical spill, defective PPE, lack of time, or much work. And the root causes might be no accountability policy, inadequate labeling, or outdated hazmat program. Root cause analysis is a reactive, after the fact activity, a process for identifying the most basic or causal factors underlying variation in performance. When the root cause analysis reveals that systems improvements or other actions can prevent or reduce the risk of such Sentinel events recurring, the hospital redesigns the process and takes whatever other actions appropriate to do so. Action plan. The product of the root cause analysis is an action plan that identifies the strategies that the organization intends to implement in order to reduce the risk of similar events occurring in the future. The plan should address responsibility for implementation, oversight, pilot testing as appropriate, timelines and strategies for measuring the effectiveness of the action. Policy statements. The purpose of this policy is to establish a mechanism for reporting and investigating the Sentinel events using the quality improvement approach to ensure that the event in question does not reoccur. The prompt and appropriate care of the affected patients shall be immediate priority of the appropriate caregivers. When hospital staff, employee, physicians, or administrators become aware that an event has occurred, simultaneous immediate notification shall be made to Department Quality Improvement Designee or Coordinator and to the department head. The Quality Improvement Coordinator will notify Head of Department and the Quality Department, who will then notify Executive Management. If the event occurred after regular office hours or on a weekend, the Medical Director on duty, on call, shall be notified by hospital operators. Safeguarding any piece of equipment, medication, medical device, and documentation that is involved in the event. Removal of evidence will occur at the discretion of the quality manager. A written account of the event attached to the occurrence variance report shall be submitted to the quality manager to include the statement of everyone involved, including the initial receiver of information within 24 hours of the event. An investigation and the gathering of information surrounding the event will be conducted by the chairman of the safety committee immediately after the notification. Notification of appropriate parties, including administrative and managerial staff, quality improvement designees, physicians, the patient and their families, patient relations, police, etc., will be made by the chairman of the safety committee. Interviewing the immediate persons involved and/or any eyewitness to the event and/or the persons who discovered the event. All staff in contact with Sentinel Events is responsible to ensure and maintain confidentiality. The Safety Committee is responsible for ensuring compliance with the policy through continuous education and monitoring. The Quality Department is responsible for the review of this policy periodically and as the need arises. The goals of the Sentinel Event Policy are to have a positive impact in improving patient care, treatment, and services, and preventing Sentinel events. To focus the attention of an organization that has experienced a Sentinel event on understanding the causes that underlie the event and on changing the organization systems and processes to reduce the probability of such an event in the future. To increase the general knowledge about Sentinel events, their causes, and strategies for prevention. And finally, to maintain the confidence of the public and accredited organizations in the accreditation process. Thank you.